pleased to have in the studio with me Neil W. McCabe, political reporter with Breitbart News, Breitbart.com. You can tweet Neil at Neil W. McCabe, M-C-C-A-B-E. Neil, welcome back.
Tom, very glad to be with you. I have an unscheduled plug.
Okay.
I just want to shout out to all of my left-wing peeps in Somerville, Massachusetts, and I know they're listening, that I hope they support Matthew McLaughlin, Ward 1 Alderman.
Okay.
That is all.
All right. Is that a Breitbart position or a Neil McCabe position?
That is a Neil McCabe position. I don't think Matt has. Matt was Army Public Affairs soldier. We were at the Defense Information School together. We agree on virtually nothing.
So he's a progressive.
Oh, he's very progressive.
You're endorsing a progressive?
Yeah, but you see at the local, there's no progressive view on like lights. Should the lights be fixed? Right? Should we have books? It's like,
well,
should
actually,
the potholes?
there are a lot of local stuff is being, our power systems are being privatized, our septic systems are being privatized.
Having said that, I just do want to make the point that at the local level, the closer you are to the people, the less you get caught up in. You're willing to
support a progressive who you actually know.
Absolutely, yeah, he's a great guy. Great guy. Matt McLaughlin, Ward 1.
All right. Chris, can we pull clip one of Jason Chaffetz? Can you get that? Okay. You've heard this?
I saw his Fox and Friends, which was very positive. And
of course it was.
Wonderful yesterday. Yeah. I didn't have time to see it today, but I understand he's wandered off the reservation.
This was on CNN. Check this out.
But access for lower-income Americans doesn't equal coverage.
Well, we're getting rid of the individual mandate. We're getting rid of those things that people said that they don't want. And you know what? Americans have choices, and they've got to make a choice. And so maybe rather than getting that new iPhone that they just love and they want to go spend hundreds of dollars on that, maybe they should invest in their own health care. They've got to make those decisions themselves.
Right. So don't buy an iPhone, buy health insurance. Right now you can get an iPhone with a plan for, what, $25 a month?
I think that's what they're banging us for, yes.
I've never even, since 73, I've never heard of a $25 a month health insurance policy that was worth anything. Is this really the Republican pitch now? This is your sales pitch? Don't buy an iPhone, buy health care?
I think
that buy health insurance, excuse me?
Everything has to be seen in context of what we're dealing with. That no one thinks that what they ginned up in 2009, 2010 was what should be or was a good idea. And yet the idea that the smartest guys in the world dealing with healthcare were the clowns working for Max Baucus and the guys in the White House who put together what we know as the Patient Protection and Affordable Care Act. And after 7 years, there are significant lessons learned, and I'm hoping that some of those are applied when we repeal and replace this law.
So we have the risk corridors that Marco Rubio famously got
defunded.
Right, he defunded this, which immediately threw all of the health insurance companies into, many of them, into a loss situation, which has caused now almost a third of the counties in the United States to only have one option under Obamacare. This was intentional sabotage of the Affordable Care Act by Marco Rubio and a group of Republicans. It took more than just him, but he was the one who proposed it. Why is that never mentioned in the media, that Obamacare is, to the extent that it's failing because of something Republicans did?
Well, President Barack Obama had many failings during his failures during his 8 years. One of his failings was his inability to persuade people in Congress to go along. And so he would just do it himself. He's like, why should I have to convince these idiots? I'm just going to do it myself.
I don't think you're answering my question here.
Well, Neil, the risk corridors were never, it was never appropriated. It was never authorized by Congress.
Actually, so it was. What the budget did was deauthorized it.
What Obama was doing is Obama was actually, he was spending money that wasn't actually authorized.
No, it was. Rubio had to take it back out of the budget.
No.
That's why it was attached to the budget bill of 2016.
I remember specifically what was going on, and Rubio was clarifying it, and he was enforcing a clawback.
Right.
He was enforcing a clawback, and certainly, but to the bigger point, Tom, President Obama was unable to persuade.
Let me just get this straight. So you're saying that the Republican destruction of Obamacare is because of Obama. That's his fault. That Obamacare isn't perfect, and that's President Obama's fault.
Yes. Yes, it is his fault. Well, whose fault would it be?
Well,
I mean, it's his signature.
I would say, had the Republicans gone along with, even one Republican with, for example, a public option.
Well, and Susan Collins voted with Obama once in committee.
In committee, but not on the floor of the Senate. And that's where Joe Lieberman withdrew his support for the but Joe Lieberman was not a Republican, but any Republican could have. But so basically, Neil, you're in the position of defending a situation where more and more people are going to find that, number one, their premiums are going up. Number two, their coverage is going down. Number three, their health insurance companies, if they miss paying their bill for 2 months, or if they're 2 months late on paying their bill, and I'm predicting now the health insurance companies are going to start billing a month late. But if they miss it by 60 days, then the rates can go up 30%. You have no control over that. So the health insurance companies have this huge stimulus to figure out ways to screw you and to avoid things like auto pay. All this stuff, this seems indefensible. I don't see how Republicans are gonna survive politically by basically trying to screw the American people.
It would be unconscionable for the Republicans not to address the problems that Obamacare caused. And essentially, this bill has been unchanged since it was passed since 2010.
You are addressing those problems by block granting Medicaid to the states, which is going to cut back on the care that a lot of Americans...
And empower the governors.
Empower the governors, right? Yeah, that works. That always works so well, doesn't it? We know that's a.
We're moving power closer to the people, not just
talking
you and your Washington egghead solutions.
Right. So the people in rural, broke West Virginia, it's just like, hey, we're just moving it to you in the state, you in Mississippi, with an average.
Well, they elect the governor there, sir.
And it's a country that is.
They have a state legislature,
that is
and they
so
all
wealthy.
But the local politicians are closer to the people, so it's never a mistake to move things closer to the people.
Unless the people.
I mean, I'm speaking as a Democrat. I'm not speaking as some liberal, fancy autocrat who just wants to decide everything from Washington.
So, and the history of that is that poor counties and poor states have crappy school systems because of the logic that you're promoting. That you want them to now have crappy Medicare. That they've had, very, very spotty enforcement of any kind of right to vote. States' rights.
Now, on behalf of crappy everything, Neil W. McCabe.
Yes, you go.
That's the Thom Hartmann explanation.
This is what I'm hearing from you, Neil. Is you're defending it because I don't understand. I don't understand the Republican compulsion to say, if the government can do something well, then we have to figure out a way for somebody to make $508 billion a year in profit off it, because that's the additional cost of a healthcare system that's based on for-profit insurance companies. We're spending $508 billion a year more than we would if we simply had Canada's
Why
system.
are you deaf to the cries of the people suffering from Obamacare? The people...
I'm not hearing them.
You're callous. You're callous to Americans.
From people
Americans who are suffering.
You're being facetious.
I'm not being facetious, because what you have is like,
I have a small business here, and we're getting great health care on the Obamacare exchange.
Listen.
It costs us a lot less than it did
Washington
before.
is booming, and you're booming, and I'm happy for your success. And I'd suggest you might have done some of it yourself. You didn't need Elizabeth Warren's help. But let me just say this: premiums are going up. Deductibles are going up
because of Marco Rubio,
and because
of Republicans.
People are stuck with plans they can't use
because of Marco Rubio and the Republicans.
So it would be unconscionable.
Although the plans they can use.
It's
illegal to offer those really crappy plans that they used to offer.
I know you're going to take a breath, so I'll get one more in.
All right.
The Republicans have to do what they're trying to do now, and
they have to satisfy their donors.
I don't think this is about the donors.
Then why is it about profit?
Well, profit is how things work here. I mean, Thom Hartmann is not in the Sisters of Mercy. I mean, I don't think who are the people here who took who are the people in this room who took an oath of poverty?
None of us in this room took an oath of office either. We're not in the government. I don't what I don't get, and I'll just
the profit motive does have its advantages, sir.
It has profound disadvantages when it has to do with things like life and death or the commons or things that are very, very complex. There's no way that you or I, Neil, can do the, quote, shopping around to figure out, what should be. Oh, gee, I've got a pain in my chest. Let's see. I'm going to call 5 doctors and interrogate each one of them about what are the possibilities of that pain. This is nonsense. What we find is that the health care should be part of the commons. It should be a right and not a privilege. We're the only developed country in the world that says it's a privilege and not a right, and it's because of people espousing the ideology that you're promoting, and it seems to me cruel, and it also seems unnecessary. Why do we have to transfer $500 billion a year to health insurance companies?
You see, but people
for nothing.
People from my sort of side of the aisle, we look at Obamacare as just looting. Like liberals and their friends have looted the Treasury.
On behalf of whom?
Well, how about the $200 million they spent in Oregon, or the $120 million they spent for themselves and for the politicians and for all those Democratic PR firms who made the healthcare.gov commercials?
My charge is that the reason why Rubio is destroying healthcare and the reason why the Republicans are doing everything they're doing is because the health insurance companies are kicking back big campaign contributions to these Republican donors, and the Koch brothers are kicking out their whole libertarian ideology. You want their money? They're hundreds of millions of dollars.
You're saying it's not motivated by love and generosity and
I'm
care?
absolutely saying it's not. No.
Okay, that's wild.
And I hear you saying in response, the Democrats are doing the same thing.
They're looters. They're hacks.
Right. So the Democrats, by saying yes, you can have Medicaid, you can have Medicare, you can be covered even with pre-existing conditions. They're not getting kickbacks from the health insurance companies. So you're suggesting that poor people are bribing Democratic politicians? Is that what I'm understanding?
No, what I'm saying, Tom,
where are the Democratic politicians getting all these kickbacks?
How about all those Democratic-related PR firms, all the Democratic-related IT companies? How about, those are the people who made the hundreds of millions of dollars setting up these exchanges that don't work, setting up these call centers that nobody ever used. There was a lot of money spent on Obamacare that served no purpose other than to
hundreds of millions of dollars,
perhaps billions. Tom.
We're talking $508 billion a year that we are wasting because of administrative overhead and profit.
This crazy system,
so-called conservative,
this is a crazy system. Why can't we fix this system? Why do we have to be frozen in 2010?
We're not frozen in 2010. We're frozen in 1950. We're
frozen in 1947 if you want to talk about
World War II.
The whole Kaiser thing.
I know. I'm agreeing with you. The entire
I would go back to pre-47.
So nobody has any health insurance.
People had health insurance.
You negotiate. Well, Ron Paul talked about how he used to negotiate for chickens in exchange for health care.
Yeah, sack of potatoes like the old days. I get it. Well, why can't you buy?
Go down to the George Washington Hospital here. Tell me you need, you got cancer and you need some surgery, and bring a bunch of chickens with you. See how that works.
Growing up in the state of Massachusetts, I saw how jacked up car insurance was because of mandatory insurance and other things like that. And they took all the same liberals who jacked up car insurance in Massachusetts and now in other states, basically jacked up what was a bad healthcare system and just made it completely unworkable.
Car insurance should not be a right. It should be a privilege. Health insurance should be a right. Health care should be a right. Why do we even... Neil, tell me, why should we even have for-profit insurance companies?
Because you can't have involuntary servitude.
No other democracy in the world allows for-profit.
So you go to medical school for 10 years and you have to work for free?
The doctors are not the ones. They don't own the health insurance companies.
Who's going to work for free, Tom?
Nobody's going to work for free. Get the health insurance companies.
So where's the money? So where's the money come from?
It comes through a single-payer system through Medicare.
Just keep borrowing from China.
Put everything on Medicare. Put everybody on Medicare. We will save $508 billion a year.
Well, what about like Canada, where they're actually imposing new rules?
They're saving $508 billion. They're the equivalent of it in Canada. They're looking at us going,
like, there are more MRI machines in Boston than there are in the entire country of Canada.
Unnecessarily.
And it's like,
you're giving a great example of the profit motive driving market dislocations.
You're against MRIs?
I'm against too many of them, or stupid, yeah.
I'm for the American people, and especially the little people, Tom.
Okay.
Their problems are my problems. Their dreams are my...
This is the Thom Hartmann Program.
Breitbart.com. You can tweet him at Neil W. McCabe, McCabe. Thank you, Neil.
Good to be with you, sir.
We'll be back.